And it is a Tuesday morning, Tuesday, September the 30th today. Yeah, it's the last day of September. It's also the last day of Prostate Cancer Awareness Month, but just because it is doesn't mean you got to stop thinking about it. Suzan Steim is with us, IRMC Urology. Good morning.
Good morning. Thanks for having me.
I'm glad that you're here today. Our visit this morning is presented by Marcus & Mack, voted the best law firm and the best personal injury lawyer 4 years in a row in the Best of Indiana County contest. Visit them online at marcusandmack.com. Prostate cancer is a very serious thing. And probably in the last 15 to 20 years, we've heard more and more about it. But information changes, I think, about prostate cancer more than it does about any other disease that we talk about.
Yeah.
It's still extremely important to learn about your prostate and to learn what kind of condition it's in, yes?
Yeah, absolutely. I've seen even a large amount of change in the 10 years I've been in urology, for example. So, yeah, I agreed. It's an important field that we need to focus on.
Yeah, okay. So, guys, we're talking to you, but we're also talking to the ladies because guys can be reluctant to go to the doctor, and so maybe they need a push from their ladies to get in to see the doctor and find out about prostate cancer. For those who are unaware, maybe they don't even know they have a prostate, what is the prostate?
Yeah, so the prostate's a small gland about the size of a walnut. It sits in the pelvis right beneath the urinary bladder. It's part of the normal male reproductive system. It produces the majority of the ejaculate that comes out. The prostate can gradually grow as you get older, and this can lead to urination symptoms, and in some men, it can be a spot that develops cancer.
Mm-hmm. All right, so what are the things that we need to do in order to be sure our prostate is healthy, and even some proactive things that we can do to help it remain healthy?
Yeah, that's a great question. So there's certain things that you don't have a lot of control over, like age, for example. As you get older, your prostate will naturally grow and increase in size. Prostate cancer additionally increases in prevalence as you get older. So usually the age of diagnosis average around 67. There's also some genetic components that can't be modified, but some things you can do would be things like having a healthy diet, especially rich in things like fruit and vegetables, having a healthy, active lifestyle, maintaining a healthy body weight, and additionally having a close relationship with your primary care provider where you can be having these early conversations regarding disease prevention and screening.
Are there foods we should avoid?
Nothing, I mean, high-fat diet, the kind of classic, some of the American diet staples can maybe put you at increased risk, but nothing super specifically to pinpoint.
All right, so let's narrow down when it is that guys should begin to be really focusing upon their prostate health. Screenings obviously are the thing that we talk about most.
Yeah. So for the average gentleman, screening usually begins at around age 50. However, if you have increased risk factors, for example, if you're African American, or if you have a first-degree relative with a family history of prostate cancer, such as a dad or brother, especially if they were diagnosed under the age of 65, you might want to consider starting the conversations around screening around age 45 or even 40 in some circumstances. But it's a very personal decision. Screening is going to always be a detailed conversation that you have with your healthcare provider, and it's going to vary from individual to individual.
And the method of screening and the effectiveness of those methods, those are changing too.
Yeah. So the cornerstone is still the PSA blood test, which has been around for a while. PSA stands for prostate-specific antigen. Everyone that has a prostate has some amount of PSA in your bloodstream generally. There's kind of a normal range given your age. So we're looking for if your PSA is increased above that or if you have a significant jump in your PSA within a year. Those would be flags that you might need to pay closer attention or pursue further workup. Often we combine that with an exam or a DRE, digital rectal exam, to see if there's any abnormalities of the prostate that might be concerning. And increasingly, we're using things like multi-parametric MRI to really get a detailed picture of the prostate, see if there's any concerning lesions, and better help fine-tune who needs that biopsy and where do we focus when we do the biopsy.
Yeah, those methods have really evolved over the last 5 or 10 years, haven't they?
Certainly. Yeah, that's probably been one of the biggest changes I've witnessed.
Yeah, and does that mean that we're better at finding cancers?
Yeah, so we want to find the meaningful cancers. We want to find the ones that are going to affect someone's quality of life and longevity. So MRI allows us to hopefully reduce the number of prostate biopsies we need to accomplish that and to be confident that we're identifying, the most problematic areas in the prostate instead of just doing a random grid of biopsies like they did historically.
Yeah. Now, recognizing that there are a lot of different factors that will determine what sort of treatment protocol you use, what are some of the treatment options for prostate cancer?
Yeah. So like you said, it's going to be variable based on a lot of things. So with your biopsy, you learn how aggressive is the cancer, how much of the prostate is involved in the cancer. Additional factors like age and your overall health are going to certainly come into play. But based on those things, one strategy, if you have lower risk disease, can be active surveillance, where you're not even getting active treatments, but we're just monitoring your PSAs and potentially doing some repeat biopsies and MRIs down the line to make sure we're not missing an opportunity for early intervention. For the more intermediate and higher risk diseases, we're thinking things like surgical removal of the prostate. Typically, that's done robotically now. Radiation therapy is another very common treatment. Sometimes these are done in combination with hormone therapy. There are newer treatments like focal therapy that are developing, and certainly something we're paying close attention to.
Yeah.
And then for the more advanced cancers, things like chemotherapy or immunotherapy might be considered. We work really closely with the Hillman Cancer Center here with the medical oncologists and radiation oncologists to help find the treatment plan that's right for each individual.
Suzan Steim, PAC with IRMC Urology, is our guest this morning here on Indiana in the Morning on WCCS. Is prostate cancer one that is considered to be an aggressive type of cancer? And can it metastasize and move to other places in the body if it's not checked?
Yeah, so there's a lot of prostate cancer that isn't, but it certainly can be that. So prostate cancer is the second leading cause of cancer in men, second only to skin cancer. And it's the second leading cause of cancer death in men, second only to lung cancer. So certainly one that you want to not write off. There can be slower growing forms that don't need to be treated, but the opposite is certainly true as well.
Yeah, and talk about the aging factor, because you touched upon it, especially for finding out for that initial time and getting rolling with the whole screening process. But as you age and prostate cancer is detected, does that change the way that you might go after it?
Yeah. So how long you're going to be carrying cancer in your body can determine how long it can evolve and spread. So you certainly are going to approach a 50-year-old with prostate cancer differently than an 80-year-old with prostate cancer. And so, that's when we kind of weigh a lot of factors in and, to determine if the surveillance versus a more active treatment would be included.
We heard in past years, a decade or more ago, that people who had prostate cancer treatment, had the prostate removed even, that they had frequent lifelong inconveniences and problems of that nature. And I don't know that today's treatments have solved any of those problems or not, but you do. So
Yeah. The treatment for prostate cancer can have lifelong consequences. So things like urinary incontinence or erectile dysfunction can be resulting from things like surgery or radiation treatments. So, you have to do a lot of careful counseling going into these things. And that's why things like active surveillance can play an important role, because if somebody has a low-grade cancer at 50, if you can watch it for 10 years, that's 10 more years of not having side effects from the treatment. A lot of these men might go on to needing a treatment, but, you're able to preserve a higher quality of life for a longer period of time.
Yeah. So prostate treatment at IRMC Urology is something that can be done. You're located in the 119 Professional Center, yes?
Correct. Yeah. Yeah. So, we're down in the 119 Professional Center. I work primarily with Dr. Burjesh Sharda there. You can call us at 724-464-2719 for an appointment. And we'd be happy to chat with you about screening, any other concerns. Of course, we treat a multitude of other urologic issues as well there.
Well, I was going to ask you about that, because I know that prostate cancer is one thing we think of when we think of urologists, but there are many concerns that urology can help with.
Yeah. Yeah. So, we do, of course, male and female urology there, so from benign prostate issues to cancerous issues involving the prostate, the bladder, the kidneys, kidney stones. We see that all the time. It's an epidemic. So many kidney stones these days. We treat female, urinary issues, urinary incontinence, recurrent urinary tract infection issues, additionally with men's health issues like erectile dysfunction, low testosterone. We kind of cover it all.
Kidney stones are one that, you hear things about it, and people get scared.
Yeah.
Thinking about the possibility.
Not something anyone looks forward to having happen to them ever, let alone multiple times. So, yeah.
That's one that scares a whole bunch of people, but treatable.
Yeah.
Just like everything else.
Treatable, preventable, all those good things. Yeah.
All right. So there are things that we can do. These are what we've learned from Suzan Stein today. There are things that we can do to help us along the trail with prostate cancer and with other healthcare concerns with urology. And it's something that you don't want to neglect. It's a very important part of your body. It's something that you need every day is the use of all of your organs, but certainly those ones. And so it's something that you need to do, and just make the call.
Yeah, absolutely.
Yeah, terrific. Hey, thanks for coming by to join
Thanks so
us.
much for having me. I appreciate it.
You've been here for how long again?
About 1 year now here in Indiana.
About a year.
Yep.
Yeah.
And then worked in Pittsburgh in urology for about 11 years prior to that. So,
Yeah.
yep.
Yeah. So how do you find Indiana? Do you like it?
Yeah, so I'm from here. Grew up here, went to high school here, and
Oh, yeah?
so
Where'd you
bit
go?
of a homecoming just here in Indiana High School. Yeah,
Oh, yeah?
I married my high school sweetheart, and once we had some kiddos, kiddo decided to move on home. So
What a nice thing. I'm
yeah,
glad you came back.
yeah, it's been lovely. We've really enjoyed becoming part of the community here.
She's Suzan Stein. Again, that phone number is 724-464-2719, correct?
Yep, you got it.
Beautiful. Thanks.
Thank
Thanks
you.
for coming in. It's Indiana in the Morning, and it's WCCS 101.1 FM, AM 1160, WCCSradio.com, 23 and a half after 8 o'clock. And it is a Tuesday morning. AccuWeather says today, cloudy early and then becoming sunny. But guess what? That sun came a little bit earlier today, and nobody is complaining about that. We like the sunshine. We like a little bit of rain, but we don't have that just at this moment. But that's okay. We'll get that fixed somehow. It's Indiana in the Morning, WCCS. Boomer Sports on the way, and then a visit from the WCCS newsroom with Matt on this Tuesday morning. Good morning to you.
7777 and ask for